I checked the chart before coming in. I provided for privacy. Washed my hands, and I'm going to check for 2 patient identifiers. Hi, I'm Cassie. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth?
Tiffany Miller, May 28, 1996.
Okay, and that is correct. Do you know where you are today?
I'm at Baker Hospital.
Okay, do you know why you're here?
I'm here for a checkup.
All right, do you know who the president is?
Obama.
All right, do you know the day today?
It is Tuesday.
Okay. All right, and those are correct. So the patient is alert and oriented times 4, person, place, time, and situation. So I'm going to start by inspecting your scalp and your hairs, but I'm going to ask you a couple questions. Have you ever had head trauma? Do you experience headaches?
Nope.
No. Have any history of head issues?
Nope.
No. So cranial nerve 1 is smell. So to test smell, I would have something smelly. Do you have any issues with your smelling?
Nope.
No, any changes in smelling? 10 and
No.
12. So can you go ahead and stick your tongue out? Okay, can you move it side to side? Can you say ah? Okay, and can you swallow for me? Okay, and can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so cranial nerves 9, 10, and 12 are intact. And cranial nerve 11, I'm going to check by putting a little bit of resistance on her shoulders and having her shrug. No edema noted. I'm going to check capillary refill on her toes. Okay, capillary refill is less than 3 seconds, so that is a normal finding. I'm going to do sensations in your feet. Alright, go ahead and close your eyes and tell me whether it's sharp or dull.
Sharp. Oh, dull.
Okay.
That's sharp.
Okay.
That's sharp.
Okay. So, it's normal.
So I'm just going to lift your leg up slowly, and then you let me know if you feel any pain at all.
Okay.
I'm just going to slowly extend.
That hurts.
That hurts?
Yeah.
Okay. Let's bring that back down.
Okay.
Okay. And Julia, we're just going to do the Babinski's reflex.
Okay.
So I'm just going to hold it like this. And just looking at. Okay. Okay, so your toes did curl in a little bit, which is good. If it were to fan out, then that would be an upper motor neuron issue, which we don't have, so that's good.
Okay, ankles. Excellent. Okay, so just lift this leg up for me. Very good. Gonna bend it out. Bend it in. Any pain? Good. We're gonna do that on the other side. Bend it out. In. Alright, any pain for this? Excellent. Alright, you can go ahead and sit up for me. Just swing your legs over the side. And then with your feet, I want you to push up against my hands. Very good. And then push down like a car pedal. Excellent. Strength 5 out of 5 in your lower extremities as well. All right. And finally, I'm going to check your Babinski reflex. This might tickle a little bit. Very good. I'm just checking to make sure your toes curl inward instead of outward, and they do. All right.
And if you mind laying back for me. Okay, I'm going to put my palms on your feet, and can you push for me? Perfect. Okay, do you mind laying this way for me? I'm going to look at it bilaterally. Okay, now I'm going to look at your posterior tibial and your dorsalis pedis pulses bilaterally. Okay. Okay. So to start with your heart assessment, I'm going to have you lay down in the bed. And I'm going to feel for any crepitus, thrills, heaves, and I'm going to also feel the pulsations of her. And now we're going to do her range of motion and strength. So Hannah, I'm going to have you lift your leg up to the sky. Good. Now I'm going to have you bend your knee up. Good. Now I'm going to have you do both those exercises, but against my strength this time. Good. Now go down. Good. Knee. Good. Good. Now we're going to do that with your foot. So lift up. Good. Now down. Great job. Okay, Hannah has full range of motion and good strength in her leg. We have our posterior tibial. Good. I've located her pulse. Good strong pulse here. Now her dorsalis pedis on top of her foot here. And Hannah does have pulse here. Good. Now her popliteal. So I'm going to have you put your foot, put your ankle across your leg like this. Good. Okay. And now I'm going to test her her Achilles reflex. So good. I just have an ice cream scoop here. And now we're going to go ahead and do her Babinski while we're down here. Good. Curl her toes. Okay.
And lay down, please. Okay. So I'm just going to take a look at your heart. So I'm going to ask you to move that leg outwards and inwards. And this leg outwards and inwards. Great. Everything is looking good there. Now I'm going to ask you to raise your leg all the way up without bending your knee. And on this side, please. Great. And now I'm going to ask you to bend your knee all the way to your chest. And on the other side. And now I'm going to ask you to plant your foot on the bed. I'm just going to ask you to bend your feet downwards and push against my resistance. Great. And bend your feet up and push against my resistance. Great. And then point your toes inwards and outwards.
You don't have any, your skin is nice and warm to the touch. And I'll come down and do the same thing here on your legs. No bruises or lesions that I can see. On either leg, and the skin is nice and warm and pink. And so while I'm down here, I will assess your pedal pulses and your capillary refill on your toes. So feeling for the pulses in your feet. And they're +3 bilaterally in your capillary refill. Is brisk bilaterally. Also, while I'm down here, I want to assess your strength in your feet and your legs. So if you could just press down on my hands like a gas pedal.
Okay.
There you go. One more time. Good. And I want to check for pretibial edema. So
with the hands, we're going to look at toes first. So the distal phalanges and proximal and everything. So we're looking at the feet. They're both symmetrical. I don't see any nodules. I'm also checking for the feet because they're walked on so much. I want to check for calluses and any warts and any bunions or anything like that. So she has no bunions and I don't see any warts, no calluses. A lot of times calluses will signify that they walk uneven on their feet also. So but she has not. She has a beautiful arch here, so we don't have to worry about that. Palpating, I'm gonna feel again, just like with the fingers, distal and proximal inner phalanges, and then the metaphalanges there. No pain in there. Plantar fasciitis, squeezing the heel here. Any pain with that?
No.
Okay. No pain with that?
No.
Okay. So I'm gonna bend your foot, your toes. Good. So that's what I want you to do. Flex your toes as high as you can, and then bring them in, and then invert that way, and then out. Good. And same thing on this side. Yep. And invert and out. So first, I'm going to do it for you, and this is going to be passive dorsiflexion, so I'm lifting up. I'm just gonna feel for movement, any crepitus in there. Okay, and then now I want you to do the same thing. Inflection, good. And then I'm going to do it for this side. Good, no pain?
Nope.
And then you dorsiflexion, plantar flexion. And then I just want you to kind of move your ankles in a circular mesh. Yeah, perfect. Okay, so she has really good range of movement on her ankles. So lay down on your back. I come on the side so the camera can see what I'm doing. So I'm going to check both of her flexion. Good. And again, flexion. And then I'm going to have you do both flexion, and then we'll lay on your stomachs for the other one. So flexion of the one leg, flexion of the other. Perfect. And then go ahead and flip onto your stomach for me. And then we're going to do extension. So with your knees straight, extension, kind of lift them back if you can. Same thing, then back. Okay, and then now you can do it for me. Perfect. Okay, now we can go back onto your back. Sorry. Okay.
Okay, we're gonna start by doing the Babinski reflex. Okay, perfect. And now we're just going to do some muscular exams. Now I want you to push up into my hand this way. Push up. Okay. And then push down. And then push up with your big toe. Good. All right, other side. Push up with that. Okay. And push down. And then push up with your... Okay, very good.
Alright, chin is intact, it's warm to the touch. Okay, let me just stick this upside down. Too close, and I'll check your big pulse. Can you wiggle your toes fine? Wiggle. Now I need you to push down on my hands. Good job. Now push up. Alright. With full strength and range of motion. I'm going to list this test called the Babinski test. I'll just stroke under your feet like this. Okay. Just might be a little ticklish. Good. No fanning out of the toes. I'll do the same for the other one. Alright, I'll check your backwards over. Okay, regular plus 2. Alright, I need you to wiggle your toes for me. Thank you. Now just push down my hands. Push up. Good. Now I'll check the Babinski sign. This one. Out of the toes. Now I'll do some walking tests. I'll have you walk from here to like right here and back. Perfect.
All right, and now looking at your lower extremities of your legs and feet, your hair here, and you are shaved. Edema, you have no swelling. Capillary refill, I'm gonna squeeze, and you immediately return, which is very good. Okay, then I'm gonna ask you to, I'm gonna palpate your heel to see if you have any tenderness here.
No.
No? This one?
Nope.
No? Okay. Feel them together. Very good. And again, I'm able to palpate it right there, 2 plus. They're equal bilaterally. The next thing that I'm going to do is move down to the ankle, and right here on the inside of the ankle is your posterior tibial pulse this side, and we will do the same on this inside. For tonsils, I'm going to grade them out of 1, And her oral mucosa is pink, her teeth are white, and her gums are pink as well. Her mouth is moist. I'm going to go ahead and look at your ears, okay? Good. All right, there is no drainage coming from the ears. There's no lesions. She does have some piercings, but she said that was normal. Down to your lower extremities, okay? All right, so have you had any pain in your lower extremities? Either. Next, we're going to go ahead and do some range of motion exercises, okay? I want you to go ahead and push down on my hands like you're pushing a gas pedal and pull up towards the sky. Good. So she has no limits in range of motion of her lower extremities. If you can just flip around, I'll move your pillow for you. Sorry, you're good. And I'll assess your back. All right, so the back. So every time I move my stethoscope, just breathe for me. And I'm going to assess your lower extremities. So toenails are trimmed, clean, and cap refill is less than 3 seconds. And now we're going to test your muscle strength. So push and pull back and twist in and out. Perfect.
So now I'm going to be inspecting the lower extremities. So when I look at the lower extremities, I'm going to note that there are no signs of erythema, no signs of any lesions or scarring or rashes. Dorsalis, pedis, pulses are 2+, strong and equal bilaterally. Now I'm going to be assessing, I can see slightly through the toenail polish for capillary refill. Capillary refill is under 2 seconds. For knee extension, and now pull it back in. For knee flexion, push your foot out for knee extension, and now pull it back in for knee flexion. Good. So now I'm going to just lift up your foot, and I'm going to have you push your toe down against my hand. So plantar flexion. Good. Now one more. Perfect. Thank you. So patient has 5 out of 5 strength in the lower extremities.
And lastly, I would check her plantar, which is just where you draw an upwards 7. Okay, good. All right.
Lay down for me, like that. I'm gonna be looking if you have any JVD, so turn your head to the left. There's no evidence of jugular vein distension, so that's normal. Okay, look forward. Feel your popliteal pulse. +2. +2. Your tibial posterior pulse. +2. +2 bilaterally. Your dorsal, pedis dorsal pulse. +2. +2. Okay. I'm gonna do some range of motions down here. I'm gonna have you bend your knee. Okay, and lift up. Good. Down. Bend it. Okay, now turn your knee in and turn your knee out. Good. Now we're gonna do it with some resistance, okay? Lift your leg up. Lift your leg down. Turn your knee in. Turn your knee out. Good. Now the other leg. Bend it. Bend it out. Lift it up. Down. Turn your knee in. Turn your knee out. Okay, stand. Now we're gonna do it with your ankles. So flex, extend, flex, extend, rotate. Okay, now with resistance, extend, flex, extend, flex. Good. Other leg. Extend, flex, extend, flex, rotate. Okay. Now with resistance, extend, flex, extend, flex. Good. And I'm gonna have you flex, and we're gonna do Holman sign. Do you have pain here?
No.
Okay. And then here, flex. Do you have pain here?
No.
Okay. I'm gonna be looking at your toenails. Good hygiene. No evidence of any lesions. Okay, capillary refill is less than 3 seconds. Good. Alright. There's no evidence of edema. The skin is warm and dry to touch. There's no evidence of any blood clots or any claudication. I'm gonna have you now sit on the bed.
You can go ahead and sit up for me. I'm going to go ahead and educate you on a self-breast exam. These are best done in the mirror after a shower. Normally, you want to look in the mirror and make sure that they are symmetrical. Okay, can I get you to stand up for me? Can I get you to, okay, pull again? Can I relax your feet? Can I get you to pull? Push. Okay, tibial, 2+, dorsal pedis, 2+. And do you have any skin abnormalities?
Perfect. I'm just going to move on to the lower extremities. I'm going to assess for cap refill. Cap refill is less than 3 seconds. I'm going to feel for your pulses. Pulses are equal and strong. Can you push against my hands for me? And push this way. Okay.
So now we're going to go ahead and just move on to lower extremities. So you can go ahead and lie down for me. Skin color is consistent with ethnicity and has a good temperature. No rashes, lesions, wounds anywhere on the body. And I'm going to first start out with your capillary refill. Okay, capillary refill is good. Less than 3 seconds on both feet. So now we're just going to test your range of motion. So if you can take your left leg and bring your knee up to your chest. Okay, perfect. And you do it on your right leg. Awesome. Okay. Can you extend your leg out to the side for me and then back and then do it on the other leg? Awesome. Thank you. Full range of motion. Your feet, so if you can push your feet against. Thank you. And pull. Awesome. Full strength there too. 5 out of 5. I'm going to check your pulse. Okay. And on the sides. Now we're going to do dorsalis pedis pulse. All right. On this side. Also present, 2+.
So I'm going to start with your head to toe assessment, starting at your head. Let me know if at any point something becomes too much for you or uncomfortable. Or... Good. I'm going to do the capillary refill on your toes. And then, can you push up against my hands? And then down on the gas pedal. Perfect. Please pick up your right leg as far up as you feel comfortable. Good, and down. And same with your left leg, please. Good. And then can you go out to the side? Good. Does that all feel comfortable?
Mm-hmm.
Not painful at all?
All right, you can go ahead and lay down for me. So I see that there are no pulsations in her stomach. I see that it's not distended. When was your last bowel movement?
This morning.
All right, have you had any bowel or urinary issues?
No.
All right, any changes?
Nope.
All right, great. So I'm gonna go ahead and listen, starting with the right lower quadrant. Can you go ahead and rotate your hip outwards, so your leg, bring it in. Full range of motion in her hip. I would check that bilaterally. Go ahead and bend your knee down. Full range of motion in her knee. I would check that bilaterally as well. Rotate your foot. All right. Full range of motion in her ankle. I would check that bilaterally. I'm going to go ahead and have you push up towards my hand, down. All right, full strength in her leg, and that is a 5, and I would check that bilaterally. All right, so I'm going to go ahead and have you push your foot towards me. All right, and then that way. Okay, great. So she has full strength in her foot. I would check that bilaterally, and I would note that as a 5. All right, so I'm looking between her toes. I do not see any lesions, breakage, ulcers, any openings. Her toes don't have any fungus. I look on the bottom of her foot. No breakage, openings, sores, anything to be concerned with. No edema in her feet. I would check all that bilaterally. So I'm going to remove my gloves. Wash my hands. And now I'm going to go ahead and check her dorsalis pedis. And I would go down from the big toe, where the bridge is. Palpate lightly, and I feel a 2+. And then I'm going to check on the inside of her ankle. If it's hard to see, you should be able to see that. So the inside of her ankle, I'm going to check for the posterior tibial.
So I'm going to go ahead and look at your legs and feet here. Any swelling?
No.
Ever? Okay. And your color looks good. I don't see any bruising. No bruising here. Okay, I'm going to go ahead and feel your pulses. And so, typically,
and so I'm going to pull the blanket up to expose the legs and lower extremities. And the first thing that I'd like to ask you to do is to see if you can bend your knees and place both of your feet flat on the bed. So what I'm doing here is I'm looking for range of motion. She has good hip flexion, knee flexion, and ankle flexion. You can extend your legs back out for me. I'm looking for swelling in any of the joints as I move down. I'm looking for color. I'm also looking for hair growth. The first point that I want to palpate on the legs is I want to palpate the popliteal pulse, which is behind the knee, hitting or where my finger indentation stays. Then I can say that you're free of what's called edema or swelling in the lower extremities. As I move down, I'm looking at the feet, and the first thing I'd like to do is I'd like to ask you to lift your right heel so I can look underneath. I'm pressing to see again if we have that good capillary refill and that there's no break in skin integrity. I'm going to do the same to the other side, again comparing as well, checking to make sure that we have good capillary refill. There's no redness or break in skin integrity here. And I'm looking for that reblanching or that blood flow back once I press or occlude the capillaries. Miss Fulton, could you press against my hands like you're pressing on a gas pedal, please? I'm checking not only for range of motion, but for strength in lower extremity. And could you pull your toes toward your nose? Pull as hard as you can against my hands. Excellent. Any problems when doing that movement?
No.
Excellent.
And I'm gonna check her pedal pulse, and then her dorsal. And you'd want to do your 30 seconds for normal, and then your whole minute for abnormal. Okay. Oh, and then capillary refill. Press on the toenail. If there's blanching, you're good. And then same situation with your feet. Just I'm gonna try to push down, try to keep them up. All right, and then push up on me. You're good. And then
now I'm gonna check your lower extremities. So can you straighten your legs out for me? Okay. First I'm gonna inspect the lower extremities bilaterally. I'm gonna palpate the digits, the ankles, the knees, and the hips, and all the muscles in between. And now I'm gonna check her legs for flexion, hip flexion, extension, abduction, adduction, internal rotation, and external rotation. Same on this side. Hip flexion, extension, abduction, adduction,
internal rotation, external rotation. Now I'm going to check your strength of your hips. So can you flex your hips upward, extend, abduct, and adduct? Interflex your toes like this, dorsiflex, invert, and evert. Okay, I want you to plantar flex, dorsiflex, good. Which is S1, S2, L4, L5. Now I'm going to check your ankle conus. Now, up, down, up, down. Okay, now.
I'm going to give you little directions and explanations of what I'm doing as I go through it. If you have any questions, just stop me and let me know.
Okay.
So I'm going to start with your head.
Okay.
If you can put your legs around the front for me. Here. Try to come out. Good. Try to come in. There we go. Try to come down against my hand. Try to come up. And get down your foot. Do you feel any pain while you do that? Mm-mm. Okay, good. Negative for Holman. I'm down here. I'm going to check the capillary refill in your toes and check you for edema as well. So about 3 seconds. Normal. No edema there. I'll wash my hands because I just want to show you.
I'm going to have you lay down, and I'm going to look at your stomach. Okay, her stomach is pink. She has a piercing. It's flat. Okay, I'm going to listen to your stomach. Leg sensations are intact. She's got calf refill, less than 3 seconds on her feet. I want you to push up against my hands, and then push down, and then push up, up. Okay. And can you roll your ankles? And then can you lift this knee and take it out? Okay. And then do the same with the other one. She has full range of motions in both lower extremities, and her strength is strong bilaterally in both lower extremities. Okay, Hillary, I'm going to have you stand up.